Welcome to another EncellaDome video, the channel helping you get smarter by widening your perspective about the world around you. To present this video, my name is Sabatam. Let's start with an illustration. Imagine you live on a quiet farm and you keep highly trained lions. Now let's imagine that these lions only eat when you tell them to do so. So you keep as much food as you can in their cage, but the amount of food that they will eat will depend on how loud your voice is when you tell them to eat. Initially, this farm is quiet, so they can eat a lot of food because they can hear your voice quite loudly. Now let's imagine all of a sudden an airport gets built right next to your farm, and this airport is so busy a plane lands and takes off every 20 seconds. Now let's also imagine that on the other side of your farm there's some construction going on and they are maybe digging a tunnel, so there's sounds of jackhammers and the like. Do you think that the intensity with which your voice was heard by the lions will be the same before all this noise around and after the noise has come in? We're going to see how this illustration ties in with our topic for today on type 2 diabetes. The important role of insulin in our body was covered in our video on type 1 diabetes. If you haven't watched that video yet, then please do so after watching this one, and the link to that video will be in the video description. But just to summarize its roles, insulin is a hormone produced by the pancreas in your body that allows the cells in your body to take up the glucose that is in your bloodstream and use that for energy production. Type 2 diabetes is a condition that develops over a long period of time, and in this period of time, the cells in your body slowly stop responding to the effects of insulin in its normal quantities. In order to respond to this, your body will instruct the beta cells in your pancreas to increase their production of insulin, hoping that this increased production will stimulate a response from your cells. As time goes by, even that increased production will not be enough. So the body will again increase the production of insulin. This continuous feedback loop eventually reaches a point where the cells in your pancreas become overwhelmed to the point where some of them eventually begin to die out. If we go back to our lion experiment, as the noise around your farm keeps on getting louder, if you needed the lions to hear your voice at the same volume and eat the same amount of food, it would mean that you would now need to shout so that your voice is heard above the sound of everything that's going on around. And as the noise keeps on rising higher and higher, it means that you need to also shout louder until eventually it reaches a point where it becomes impractical for you to outshout all the other noise that is happening around you. In a similar way, the insulin overproduction occurs over a long period of time as your pancreas is trying to produce more and more in order to keep up with the demand, and in the process it will start wearing itself out. So much so that by the time someone is diagnosed with type 2 diabetes, they would have already lost 50 to 70% of their insulin producing cells. As we have already established, symptoms of type 2 diabetes often develop slowly, usually over a course of several years, and it can be so mild that you may not even notice them. Many people do not have symptoms. Some people do not find out that they have type 2 diabetes until a point in time when they develop diabetes-related health problems. We can now quickly look at these symptoms, and these are increased thirst and frequent urination, increased hunger, blurred vision, numbness or tingling in the feet or hands, unexplained weight loss, fatigue, slow healing of wounds, frequent infections of the skin and urinary tract. We're now going to look at a few factors that can increase the chances of you developing type 2 diabetes. The first factor that we're going to look at is weight. Being overweight is a main risk factor for type 2 diabetes, but this does not mean that only overweight people develop it. The next factor is fat distribution. You have a greater risk of developing type 2 diabetes if your body fat is mainly around your abdomen. And if you're a man, your chances of type 2 diabetes increase significantly if you have a waist circumference above 40 inches. The next risk factor is physical inactivity. The less active you are, the greater the risk of type 2 diabetes. This is because physical activity helps you control your weight as it uses up glucose as energy and also makes your cells more responsive to insulin. Next is family history. You have a higher risk of developing the condition if your parent or sibling has type 2 diabetes. The next one is age. Your risk increases as you get older, especially after the age of 45. That's probably because as people age, they tend to exercise less, they lose muscle mass, and they also gain weight. Even though it's mostly associated with older people, type 2 diabetes has been seen to be dramatically increasing among children and young adults as a result of an increase in childhood obesity. The last risk factor is prediabetes. Prediabetes is a condition in which your blood sugar levels are higher than normal but not high enough to be classified as diabetes. If left untreated, prediabetes often progresses to type 2 diabetes. We're now going to look at the management in people who already have the condition. People with type 2 diabetes are given medication that they need to take every day in order to keep their blood glucose levels under check. But there are a few other things that you can also do in order to help manage your condition. For one thing, you can maintain a balanced diet that includes non-starchy vegetables, whole grains, fiber, lean proteins, and unsaturated fats. You should also avoid unhealthy fats, sugars, and simple carbohydrates. You should also aim to achieve and maintain a healthy weight. You should exercise on a regular basis, and you should also take all your medication as recommended by your doctor or pharmacist. If possible, get yourself a home blood glucose monitoring device so that you can be able to monitor your blood glucose levels throughout the day just to make sure that it doesn't get too low or too high. Another thing that will help is to let your family know about your condition. Educate them about the warning signs of blood glucose levels that are either too high or too low so that they're in a position to help you in case of an emergency. We'll now look at prevention. Healthy lifestyle choices can help prevent type 2 diabetes, and that's true even if you have a family history of diabetes. If you've already received a diagnosis of diabetes, you can use healthy lifestyle choices to help prevent complications. If you have pre-diabetes, lifestyle changes can help slow or stop the progression to diabetes. The following are a few healthy lifestyle choices that you can make. Number 1, healthy eating habits. Choose foods that are low in fat and calories but higher in fiber. You should eat more fruits, vegetables, and whole grains. Eat smaller portions to reduce the amount of calories that you eat each day, and this will also help you to lose weight. And lastly, drink water instead of sweetened beverages. Another healthy lifestyle choice is getting physically active. Aim for a minimum of 30 to 60 minutes of moderate physical activity or 15 to 30 minutes of vigorous aerobic activity on most days. Other things that you can try are brisk walking, riding a bike, swimming. Try as much as possible to stay active throughout the whole day and avoid sitting for too long. The third healthy lifestyle choice is losing weight. If you are overweight, losing 5 to 10% of your body weight can reduce your risk of diabetes. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. Motivate yourself by remembering the benefits of losing weight, such as having a healthier heart, having more energy, and improved self-esteem. Ultimately, whatever preventive measures you choose should be something that will work for you in the long term. For example, there's no point in suddenly deciding to start exercising for 6 hours a day or suddenly reducing the amount of mishima you eat from 4 lumps to half a lump of mishima if you know that you won't be able to keep these up in the long run. In conclusion, it should be noted that with the right treatment and care, the effects of diabetes and high blood sugar levels can potentially be reversed and certainly managed. In as much as type 2 diabetes is a lifelong condition and gets worse over time for most people, it doesn't have to be like this for everyone. With the right treatment and positive health changes, you can be able to enter remission. This is a state where your blood sugar levels go back to normal and you don't need to take diabetic medication anymore. If you love books but can't seem to have enough time to read, then try AudioBooks. It's a service that allows you to download audiobooks of your favorite titles, and you can enjoy these on your iOS, Android, Sonos, Kindle, and Alexa enabled devices. If you have multiple devices, whenever you switch to a device, you can pick up wherever you left off on the other device. Start your 30-day free trial and get 1 audiobook plus 2 Audible originals. If you don't like the audiobook, you can swap it for free. After the trial period, membership is only $14.95 a month, and you get 1 audiobook and 2 Audible originals each month. Check out the affiliate links in the video description to start your free trial today and get a 30-day commitment-free guarantee. If you would like to advertise your products or services on our platform, then don't hesitate to contact us. You can send us an email or you can directly message us on our Facebook page, and we'll be able to get in touch with you and find out how best we can help your business grow. If you like what we do here and would like to sponsor us so that we can continue producing educative content like this one, then consider becoming a Patreon by going to patreon.com/EncellaDome and become a Patreon so that you can keep us financially healthy. We've come to the end of the video, and thanks for watching. Please like, subscribe, and share this video with your friends so that they can also benefit 1 or 2 things.